Dr. Ed Dean from the left coast of Florida.
All right, good morning. My name's Ed Dean. I am an emergency medicine physician. I have practiced and studied medicine for 30 years. I was introduced to the scanner approximately 2 years ago, 2.5 years ago, and I'd like to share with you my story in hopes that you will find value. When I was young and in practice, just getting into practice, I was an adrenaline, testosterone-fueled buck, and I found it very appealing to go into emergency medicine to snatch people from the jaws of death. As I got a little bit more experienced, I started to question that, particularly when I was unsuccessfully trying to resuscitate 60-year-olds, 50-year-olds, 40-year-olds, even 30-year-olds. And I started to ask, isn't there a better way? That had an exclamation mark. That question mark turned to an exclamation mark when about 15 years ago, my father, who was a physician, died suddenly at the age of 62. 2 months earlier, he had a routine physical and actually did very, very well in the stress test. Matter of fact, did better than anybody else in the medical center. It was almost 15 years ago. I was in the emergency room that day when he came in to the emergency room and they were doing resuscitation on him. That's a very, very powerful thing. So as I matured, I decided to change my practice, and I now have a preventative wellness practice in Naples, Florida, where I really focus on cardiovascular risk assessment and reduction. There's a lot of different ways to practice medicine, but that really is my focus, and that's the focus of emergency medicine. I'm very interested in things that work well. I'm very interested in shortcuts. And again, that's my training in emergency medicine. So when it comes to the heart, a lot of times you just think of the heart, but really we're talking about the cardiovascular system. If you could next. And really, so your heart really supplies 100 trillion cells, okay? Each one of those cells is really dependent on getting the proper nutrition and also having the proper energy. And I think Joe did a great job really talking a little bit about the importance of that and the importance for, in our aging process of having healthy cells that have nutrients, that have a proper blood supply to deliver nutrients and also to take those nutrients back. Next. And to do that, we have 100,000 miles of blood vessels in our body. So to put that into perspective, if you wrapped our blood vessels end to end around the earth, it would go around the equator 4 times, 4+. So that's really the focus of my practice, really help people get this under control. Next. So when I'm in the business of trying to help people improve their health, my training was emergency medicine, so I really didn't have a good sense of whether or not, people needed supplements or not. And, you'd see various things out there, and I think someone mentioned that it was the Wild West. You see studies that say yes, and you see a lot of studies that say no. I did my own due diligence, and I really realized that most of my patients had nutritional deficiencies. Next. I started using a laboratory out in Texas. They do some fancy testing. The problem with this laboratory is it's expensive, $300 to $400, and it takes about 4 weeks to get the results back. The other thing that was a problem is once I did some testing, I found nutritional deficiencies in everybody, and I went to a lot of my colleagues and I said, what are you guys doing? They go, well, listen, if they're deficient on selenium, I put them on selenium. I go, what do? You retest them? I go, insurance doesn't pay for it, but we test them next year, and when we come back, we find out that they're up on selenium, but they're down on something else. I said, okay. Anyways, I received this letter from them, and I highlighted this, and they said, for the past 18 years, our testing indicates that over 90% of patients have functional micronutrient deficiencies. And this is what I was seeing in my own practice. At the time, I also employed a dietitian, and she was coming in, spending 2 or 3 hours with my patients, again, at a cost to me, but really in an effort to better their health. I felt it was well worthwhile. About that time, I was introduced to the biophotonic scanner. Next. And it so happens that Dr. Oz did a TV show on the biophotonic scanner, and lo and behold, look at that, about 90% of the people in his audience showed that they had low nutritional scores. Huge correlation there. And I started looking at this and I said, you know what, this seems like a really innovative machine or instrument. I hopped on the flight. I went out to Provo, Utah to take a look at it. I went out there and I really looked at this and I said, boy, this instrument is real. It's going to really help my patients. And it also is something that's quick and really is a shortcut to nutritional assessment. As a matter of fact, Dr. Oz called it the ultimate lifestyle lie detector test. And I have found that also to be true. So one of the things I do in my practice is I do a risk assessment using something called the cardio risk scan, and they basically look at your carotid artery, and they're able to give you your cardiovascular age. And I use this is a patient that I have, and I think it's difficult to read here, but he is 55 years old. And at the time we scanned him, he had initially had a score of, he had an arteries age of 47. Next. This was in the year 2009. I was introduced to the scanner in October of 2011, and again, you can still see that he has an artery age difference from his chronologic age to his physiologic age of about 8 years. Next. I've put all my patients that are interested in health on the LifePak Nano, Vitality, and T-Green 97. As a way to optimize their nutritional health and also to optimize their mitochondrial function. And you can see this is from March of 2014. This patient now has an arterial age of 18 years younger. Now this is multifactorial. It's not just the supplements, but I really believe that the supplements are very instrumental in helping me achieve this type of health in my patients. I also have patients that have arterial ages that are greater than their chronologic age. I put this together last night, and I didn't include any of those, but I often have patients that have, let's say, an arterial age of 70 when they're 60, and we've been able to get them down, maybe 5, 10 years younger. And our goal is, and I tell my patients this, is to get you to 80 years old with 60-year-old arteries, and not get you to 60 with 80-year-old arteries. And I'm including this here not to impress you, but to impress upon you that I feel that it's incumbent on all of us in the healthcare industry to really share with our patients any information that will improve their health. And so I think that we need to practice what we preach. We need to walk the walk, talk the talk. I feel obligated to share this technology with all of my patients because it's a rapid way to really assess their nutritional and lifestyle status, and also it's a real motivation for behavioral change. So not only do they need to take the supplements, they need to diet and exercise. Next, so this is my own arterial scan. This is when I was 50. I had an arterial age of 54. I exercise, do those types of things. 44, excuse me, but 6 years younger than my chronologic age. And then I went down to 11 years younger than my chronologic age. And finally, this was in March, down to 19 years younger than my chronologic age. And again, I tell you this not to impress you, but to impress upon you that it is our obligation, and I'd even go as far to say, as far as I'm concerned, it would be unethical for me not to share this technology with my patients. And if I was in Judge Judy's chair, I would even go as far to say, slap me with a malpractice suit if I wasn't using this and really all that I came across. So, one thing I left out, it's really important. When I went out to Provo and I started to use the scanner, I really had to prove this science to myself. And so I went to a lot of my other colleagues, and one of the colleagues that I went to had been using the scanner for a while, and he was a real skeptic. And he actually did the extensive testing before and after each time he scanned somebody. And I asked him, what did you find? He goes, well, before I scanned them, they had a low scanner score. They all had nutritional abnormalities. Scanner score came up, sent the lab tests out to Texas, came back and their nutritional deficiencies had declined. I said, wow, that's really powerful. I don't need to do that test that takes a long time, costs a lot of money anymore. And then I also went to another colleague who was using some real fancy testing to test your endovascular dysfunction. And he also was using this. He says, gosh, I put everybody on LifePak Nano and their endovascular function declined. So I wanted to include that to really substantiate, I believe, why this really helps, with your arterial aging. So back to you.